about 6 months ago, I had the chance to meet Matt McNally for the first time, and what started off as any other client meeting quickly turned into something a lot bigger and greater. Being new to the healthcare space, only a couple of years into it, I shared with Matt some of my thoughts around this concept of the point of care and how in-step health is becoming something much bigger than that and broader than that, where it really covers the whole care continuum of care. And Matt shared with me with his vast experience in the healthcare space on the agency side, on the vendor side, and now again with Dentsu Health and recreating the whole agency experience, we really found a common bond around this whole idea of challenging some of the status quo in the industry norms around how an agency provides its service, how a third-party vendor like In-Step Health provides its service. And we coalesced around this idea around the persistence of care, that healthcare really doesn't start or end at any one point, and it doesn't just touch the healthcare provider or the patient. It's really all places, all time, to all different parties. And the idea ended up developing into what is now this thought leadership white paper piece that we've named the persistence of care. And it's what became this white paper has now grown into a partnership between our two companies that we're really excited about. And so I'm looking forward to Matt and I chatting a little bit and sharing with you guys some of our thinking in the area.
What was interesting too is I been doing healthcare marketing for like 25 years and took a brief stint and went publisher side. And I swear I was never going to go back to agency life because I just thought there was just so much in this marketplace that was like a sea of sameness. So one thing, I got excited to go to Dentsu Health because they were doing something different, but then when I got to reconnect with a lot of publishers, candidly, some were doing a lot of the same stuff. But we were really excited when we sat down with your team because you are doing different things, and we started to think there's a kind of a 1 + 1 = 3 here on how you're viewing that health happens, yes, in the exam room, but health now kind of happens everywhere. And our kind of challenge on, okay, given that, as an agency, how can we help brands create better content, knowing that how patients and HCPs are engaging with health content happens in a lot of different places.
Yeah.
So we got excited. It was like two groups doing two different things, but with the same common goal of like, how can we be courageous? How can we be brave and challenge the industry to do new things? So it's been fun.
Yeah. And for us, I guess, like what that meant is, being a relative newcomer to the healthcare industry or to the pharma industry, I heard about this point of care, which I understand as a consumer, but it really, like for me, again, as a consumer, as a father of 3 daughters, as the son to a dad that had a terminal illness, to me, like the point of care was kind of all over the place.
Yeah.
I mean, it was me dealing with one of my daughters who has a fever and a cough and all this other stuff at midnight, and it's Dr. Google. Or if it's during the day, I go to the pharmacy and I kind of try to self-medicate her or treat her however I can. Or it's learning about my father's terminal illness and learning and understanding that and figuring out even like what kind of doctor do I even direct him to go to. And so for me, it wasn't this point of care, because this point of care is the doctor, the pharmacy, the house, the phone, whatever. It's this persistence of care and really trying to find healthcare in all of these places, and knowing that I could pick up, that could start or end or really continue anywhere along that journey, like anywhere, anytime, anyhow.
Well, that's why I got excited when we first talked, because the legacy thinking of point of care was the physical space in the doctor's office.
Yeah.
Like that's how this industry forever has thought about it. And it was always called this kind of magic moment between the patient and their provider happened in the office. But to your point, that part of the journey is a nanosecond.
Right.
The amount of time that a patient is spending in the office now, yes, it's a really important time, but they're doing what you're doing.
Yeah.
You're going home and you're Googling it and finding out, or you're calling your friend, or even you're checking out hashtags on Instagram. We saw a great presentation today that was like, someone did hashtag eczema to see like, how are other people dealing with their disease and using Instagram as like a channel. That's persistence of care.
Right.
This idea that it is happening in all different places, not just that physical moment between the doctor and the patient.
Right. Well, and another thing that we've been talking about is also how the changing world of pharma and just the types of drugs that are coming down the innovation pipeline are also influencing how that persistence of care and how that messaging is happening. And it's no longer these mass market drugs, these blockbuster drugs that any single one of us can relate if we have an allergy or something
Yeah.
like that. It's like, oh yeah, I want that drug, that Nexium drug or whatever. But it's now more like, wow, like this is a really complex disease that I have, and the conversation now, it goes to a different spot. You want to?
Yeah, well, I liked a few weeks ago in our teams, we were like talking about that idea, and we were talking about the notion of, well, what's the role of HCP marketing and communications, and what's the role of DTC marketing and communications given the pipeline? So the consumer and patient historically played a massive role in their treatment decision-making process when the pipeline was gen meds. When you could go in and say, all right, I have high cholesterol, I want X brand, because kind of a statin was a statin. Or when it was allergy medications, GERD, heartburn, all of those things. Well, now that there's so many factors that go into a patient actually being in play for a specific product, it's also been fun as our companies have talked about what is the role of DTC communications versus HCP. Kind of that balance is shifting.
Yeah.
We're seeing a lot more, and I don't like to say the word control, but a lot more of the control is shifting back to the provider, where the pharmaceutical industry is now kind of, they swung so far to DTC. It's like, how do we get those things kind of integrated now and working together? And I think that's part of the persistence of care notion too.
Yeah. Well, and it's also, I think that it's what's so exciting to me about working with you and working with other people that are more forward thinking and challenging clients and challenging the industry to do things differently, to not just rely on old tactics in the old ways, and really think about like, okay, how do we talk to a doctor? How do we talk to a patient, and where do they sit in that persistence of care?
Yeah.
How do we touch it?
Well, it's been interesting because I think one of the pushbacks, not pushbacks, but you get from clients when you start to talk about health happens everywhere, everybody's different, personalized communications. A lot of the pushback we often get, they're like, well, it's hard. That means like 20 pieces of content, and we've got to get it through MedReg. And I'm like, having cancer is hard.
Right.
Having a chronic condition is hard. If we all are truly about patient outcomes, and now there's all these different channels and all these different ways to engage, we need to create the experiences and meet the patients and HCPs where they are. And yeah, it's hard.
Yeah.
But what they're going through is a lot harder than us trying to get 5 pieces of creative through MedLegal. Like, we have a service, I think, to do that and step up a little bit better than we have in the past.
Yeah. And I would challenge, as a vendor, I would challenge the brand teams, I would challenge the agencies as well, but I think a lot of it falls onto the brands themselves, is to think about the holistic message and that persistence of care for their particular drug, and where they start to break up, oh, well, we've got an agency for HCP, we've got an agency for DTC, oh, we go somewhere else for creative, and maybe strategy is even another shop, and that, I think, gets hard for everybody, most importantly the patient at the end of the day, because they end up with a disjointed message, or they don't even get onto treatment. And so for us, like as a vendor, it's okay, well, when InStep Health comes with this kind of broad set of solutions, or this broad platform to be able to reach providers and patients all across this persistence of care, it like half the message falls on deaf ears, because they're like, well, that's not my shop.
Well, it's interesting. One thing that we've started to talk to clients about, like, you can't wave a magic wand and have maybe a single agency. But I think what we've been talking to clients a lot about is like, we get it, good fences make good neighbors, but you have to encourage your agencies. It's okay to jump over the fence. If you're the consumer-facing agency and you meet a publisher, or you meet a partner that has a really smart HCP idea, jump over the fence, hear them out, then take the idea to your sister agency. So many clients have created these IATs, integrated agency teams, but at the same time, if it doesn't fall within a specific agency's remit, a lot of times they are going to give you the Heisman and say, not me.
Right.
But we think there has to be this idea. It's like, jump over the fence, even if it's not your responsibility, be courageous, be brave, and like try to get that idea to the client and partner with the other agency to make it happen.
Well, I think the challenge for all of us now is to really reflect and think, with this changing world, what are we going to do differently? Where are we really going to make change so that we can have a better conversation with patients, with providers, to get better outcomes?
I agree, and I would even push it a little bit further, and it's like, the past 18 months have been tough for all of us, and I think everyone kind of probably relate to a moment in their personal life where you were brave and courageous in some area. Maybe you went and did something for the first time, or you had that difficult conversation with a friend. I think the transformation that we're seeing in healthcare marketing, it's what are you going to do different, but where are you going to be brave and courageous to push that difference? Either as a brand marketer, an agency, or a publisher where maybe historically you're like, yeah, I wasn't going to push too hard. It's like, where are you going to have the courage to kind of be brave and push for, I think, what we need to do better for patients and physicians?
Well, I look forward to the challenge and working with you on
Same.
it and with all of our clients.
Absolutely.